Senator Henkel. Thank you, Madam Speaker. Senator Gold, women's health remains largely neglected in our public policies. From 2009 to 2020, only 5.7% of grants from the Canadian Institutes of Health Research were devoted to women's health, often focusing on cancer. Issues such as endometriosis and mental health receive a mere 3.8%. As a result, women are diagnosed on average 2 years later than men for over 1,300 common conditions. Endometriosis, on the other hand, takes over 5 years to be identified. Also, women spend 25% more of their lives in poor health, and in 8 provinces and territories, gynecological surgery is reimbursed 28% less than comparable male procedures. I'm available to provide you with access to the data that I've just provided. Is the government ready? Thank you, Senator Henkel, but I'm now going to ask Senator Gold if he has a response to your question. Thank you for having raised the difficulties that face women and the gaps that are there. I'm not surprised to hear it, but it is disappointing. If I can read between the lines, the government will tackle this problem with seriousness and in collaboration with provinces and territories who have a constitutional responsibility for these issues. But there is a role to play for the Canadian government, and the government will do so, given the importance of the issue. Senator Henkel. In this future strategy, will the government commit to correcting funding discrepancies, requiring the systematic disaggregation of data by sex in research, and including women fairly in clinical trials, so the treatments are finally designed for them and not simply adapted after the fact? Senator Gold, thank you for the question and for emphasizing the importance of disaggregation of data. We have already taken some steps here, thanks to several interventions by senators. The work must be done, must continue, and it will.
Thank you, Speaker.